On behalf of my colleagues and I want to reassure all of you during this time of COVID-19 that we are here for you and we understand the difficulties you're facing and encountering in this unprecedented time. I want to let you know that eosinophilic GI diseases are not primary immune deficiencies, and therefore we are not expecting to see a surge of COVID exacerbations in eosinophilic patients. The COVID should affect eosinophilic patients similarly to what it affects the normal population. Of course, we're not certain about this, and we are now beginning to research this question. We do know that eosinophils are not part of the normal host response against viruses, and that eosinophil depleting drugs and biological antibodies that block allergies have not been associated with severe viral infections, and that to us is somewhat reassuring. We also know that patients with elevated levels of eosinophils, with eosinophilia, including the hypereosinophilic syndrome, have not been reported to have viral pneumonias and exacerbations of infections. And again, this reassures us that patients are not going to have increased susceptibility. The caveat to all of this is, of course, that we do not have direct data on the question. We do know from studying other coronaviruses that we don't expect a problem. I do want to indicate, however, in rare eosinophilic patients that are on systemic glucocorticoids, or the disease may be associated with a systemic immune dysregulation, the chronic nature of their disease and the immune problems may, in fact, be associated with susceptibility to COVID. But this is not going to be the case in most patients. We are actively studying this. Also wanted to let you know that we feel for those of you who suffer from food allergy-induced GI diseases. We know and we keep on hearing from you how difficult it is to obtain food to be secure around dietary issues and the challenges of both obtaining food but also not knowing how to monitor the GI disease because endoscopies aren't being regularly performed under these current conditions. Of course, for urgent issues, always available in many ways. One of the advantages of COVID, if you want to call it that, is that we have expanded and rolling out telemedicine now. And this gives us an opportunity to directly interact with you through this new venue and to be available to assess your problems and to work with you on the issues that you're encountering. When it comes to dietary issues, I just wanted to give you 2 points. One, please continue to keep in touch with us with your questions. Our dietitians are readily available and will also work through telemedicine as needed. Second, please be careful with your foods. When you go shopping, please realize that that's a potential exposure. I personally recommend that you order food as much as possible. And remember that when the food comes into the house, it could be contaminated with this very durable virus, and therefore you should use disinfectants and other precautions when eating the food or when having any encounters with it. One of the notable findings so far is that the coronavirus is susceptible to microwaving and also to heat. So keep that in mind as you process your food and prepare it. We also now understand that freezing the food does not likely destroy the virus, so keep that in mind as well. We'd like to turn this over now to my colleague, Dr. Furuta, so he can follow up with a couple of other important points that we wanted to share with you. Thank you, and keep in touch, and continually let us know the issues that are important to you and your family. Best wishes for safety and health and continue unity with us and your loved ones during this rough time.
Thank you, Dr. Rothenberg. My name is Glenn Furuta, and I have the privilege of serving with Dr. Rothenberg and my colleagues in CEGIR in addressing our mission of improving the lives of patients who have eosinophilic GI diseases, or EGIDs. While we cannot fully comprehend or understand the heartaches and challenges that you are occurring during this COVID-19 pandemic, we have heard from your patient advocates about many of those. Today, we wanted to try to provide you with some words of encouragement and hope surrounding those. First, if you have an eosinophilic GI disease and are doing well, then please continue to follow the plans of your local provider. that may include the use of topical steroids. We have not found topical steroids to be immunosuppressive. If you're also being treated with hypoallergenic formulas or specific diets, then please again continue to use those to optimize your nutrition. We want that nutrition to be as optimal as possible and the offset chance that you may incur an infection, unfortunately, and have the best chance to fight it. If you have an EGID and are feeling poorly, then please contact your local provider to try to identify a new plan or treatment approach. We cannot, again, appreciate how frustrating it might be if you're not able to undergo an endoscopic procedure to understand what might be going on. But please know that there have been many discussions and thoughts around whether or not to perform procedures today. And overall, I can tell you that the risk of having a procedure performed are outweighed by the benefits of information that may be gathered at the time of a procedure. Third, if you are a patient who has a new diagnosis of an EGID, then again, please consult with your local provider to identify an optimal treatment plan. If you're seeking more information, know that there is a large amount of data and information available on websites as well as social media platforms. In particular, are patient advocates of APFED, Cured, Eosinophil Family Coalition, and the EOS Network are robust sources of information and advice. The CEGIR website also has a lot of information that may be valuable to you. Finally, we wanted to provide you with some words of hope and encouragement. We in CEGIR are incredibly dedicated to improving your lives and performing research that, in the big picture of things, will improve your lives overall. Even though clinical research has virtually halted because enrollment has stopped, know that all of the information that we have gathered thus far in CEGIR is currently being used in many ways to try to improve your care. The surveys you have completed, the samples that you have selflessly provided, and other information that you have given during the course of CEGIR as you have enrolled is currently in many ways undergoing assessment and analysis. For instance, Dr. Aceves and Shota are investigating novel pathways that may be associated with eosinophilic GI disease. Dr. Shahade, Dr. Amanda Muir, and Dr. Dellin are undergoing a worldwide effort to try to understand the association of COVID-19 and EGIDs. We'd like to just close by saying, again, we're incredibly dedicated to performing research that in the big picture of things will help to improve your care. I close by saying, in the words of Dr. Dan Atkins, my colleague here in Colorado, to please remain physically distanced, but not socially isolated.